Let's go to our topic today, that is shoulder dislocations. So let's understand what is the normal anatomy of the shoulder, and after that we'll talk about the several types of shoulder dislocations. So first, let's understand the shoulder joint. So we know that our shoulder joint or the shoulder girdle is composed of two main bones. The first one is the proximal humerus. So this junction here is the proximal humerus, and that is being held by a cup or a socket, and that socket is the one present here, which is the glenoid socket. So you have the glenoid socket and you have your proximal humerus that is sitting inside the glenoid fossa. So this is a ball and socket type of joint. So what is a ball and socket type of joint? Where one structure resembles a ball and the other structure resembles a socket or a cup. So you know any other ball and socket joints? Okay, we know another ball and socket joint, that is the hip joint. So in hip joint also there is a ball, and what is that ball? That is your femoral head. And what is a socket? The socket is the acetabular cavity. So both of this together form a ball and socket joint. But students, imagine what is the difference between your hip joint ball and socket joint and your shoulder joint ball and socket joint. Are they the same? They are not, because in a hip ball and socket joint, the femoral head is a rectangle, large surface. Along with that, there is an acetabular socket which is also large. So there is a proper articulation between the acetabular socket and the femoral head. Same way, compare that with this shoulder joint. So your shoulder joint has a very small, so you can see here, there is a very small glenoid cavity and there is a very large humeral head. So it is a ball and socket joint, but the humeral head is 4 times bigger than the glenoid cavity. So keep this in mind that hip joint and shoulder joint both are ball and socket joints, but the major stark difference is that in the hip joint there is a large femoral head and an equally large glenoid cavity, so there is a perfect articulation. But in a shoulder joint there is a large humeral head and a very small glenoid cavity. So this ball and socket joint is not a perfect articulation. So what is being mentioned in books is that this is not a ball and socket joint, but a golf in a tee experience. So have you seen a golf? Have you seen golf? How is it kept on a tee? So there is a very small tee on which a golf is kept, and then you hit that golf ball. So the articulation here is very similar. There is a very small glenoid cavity which looks like that tee, and there is a very large golf ball, that is your proximal humerus. So what is the use of this? Why has God created such an imperfect joint for us? There is a reason to this. The reason is that we enjoy a wide range of movements with our shoulder. So our shoulder allows us to do adduction, complete adduction, a complete range of abduction, overhead abduction. Also you can do internal rotation, external rotation, also extension and flexion. So all these movements are possible in the shoulder joint. It is not possible in any other joint. So the reason we are able to enjoy so much mobility is because of this bony articulation not being perfect. So the reason that God has given us such an imperfect shoulder joint is because we get more mobility. So this in shoulder joint there is more mobility, in hip joint there is more stability. So what is the one sacrifice that we have to do for enjoying this mobility? We have to sacrifice stability of the shoulder joint. That is why the shoulder joint is not very stable, but it is very mobile. Now understand, is this enough? So why is it that even though we have such an imperfect articulation, still not every shoulder dislocates? So we have very less chances of shoulder dislocations because there is something called as a stabilizing factors. So there are certain capsules, there is a labrum, there are certain structures which are seeing to it that the glenoid or the proximal humerus is sitting well within the glenoid cavity, and those are the stabilizing factors, and that includes your joint capsule. So there is a capsule within the joint, and then you also have the labrum. I'll talk about the labrum next. So you have the capsule, you have the labrum, and then you also have something called as the rotator cuff muscles. In anatomy, you'd have studied about the 6 muscles. Which are they? They are the supraspinatus muscle, the subscapularis muscle, the infraspinatus tendon, and the teres minor. So these 4 rotator cuff muscles form a kind of sling around the shoulder joint, and they see to it that the shoulder joint is well seated or well protected.